Have you ever glanced down at your feet and wondered if they were trying to send you a message? It might sound a little out there, but your feet can actually reveal hidden signs of stress in one of your body's most vital organs, your liver, and trust me, catching these signs early could be a game changer for your health. Let's start with the basics. Your liver is an absolute powerhouse. Think of it as your body's master filtration system, chief chemist, and metabolic regulator all rolled into one. It filters out toxins, produces bile to help you digest fats, manages your metabolism, and keeps essential nutrients in perfect balance. It's working 24/7 to keep you healthy. But what happens when this powerhouse starts to struggle? Well, the clues can show up in some pretty unexpected places. Like your feet, one of the most common and often overlooked signs is swelling, also known as edema, in your ankles and feet. Have you ever found your shoes feeling unusually tight at the end of the day? Or maybe you've noticed some puffiness that leaves an indent when you press on it. It is easy to just write this off as standing too long or too much salt, but it could be a crucial warning sign. When your liver isn't functioning properly, it can struggle to produce a protein called albumin, which is essential for keeping fluid in your blood vessels. When albumin levels drop, fluid can leak out into the surrounding tissues, and because of gravity, it often pools in your feet and ankles. So, persistent swelling isn't something to ignore. It's your body's way of saying, hey, something's not right with our fluid management system. Next up, let's talk about color. Take a good look at the skin on your feet, especially the soles. Have you noticed any unusual discoloration? A yellowish tint, or even skin that looks unusually pale, can be a major red flag. This yellowing is a classic sign of jaundice, which happens when a substance called bilirubin builds up in your blood. Bilirubin is a yellow pigment produced when old red blood cells are broken down. A healthy liver processes it and gets rid of it, but when the liver is damaged or overwhelmed, it can't keep up, and bilirubin levels rise, staining your skin and even the whites of your eyes. While jaundice is often most noticeable in the eyes, it can definitely show up on the skin of your feet, too. Another visual clue to watch out for is the appearance of tiny, web-like veins, often called spider veins or spider angiomas. You might see these spidery red or purple lines on your feet or ankles. Now, these can sometimes be harmless, but they can also be a sign of a more serious issue called portal hypertension. This is a condition linked to advanced liver problems where scar tissue or damage obstructs the normal flow of blood through the liver. This blockage forces the blood to find other pathways, putting extra pressure on the smaller, more delicate veins, causing them to expand and become visible on the surface of your skin. If you're seeing new clusters of these pop up, it's worth getting checked out. But it's not just about what you can see, it's also about what you can feel. Strange sensations in your feet can tell you a lot. Do your feet often feel unusually cold, even when you're warm? Do you experience tingling, numbness, or that pins and needles feeling for no apparent reason? These sensations, known as peripheral neuropathy, can be linked to liver dysfunction. A struggling liver can lead to nutritional deficiencies and a buildup of toxins that can damage your peripheral nerves, which are the nerves outside of your brain and spinal cord. Your hands and feet are often the first places to feel the effects. And what about pain? If you're experiencing persistent cramping or a dull ache in your calves and feet, especially at night, don't just assume it's from a workout. This can be another subtle but important signal. These cramps can be related to fluid imbalances, mineral deficiencies, or poor circulation, all of which can be downstream effects of a liver that's not performing at its best. The extremities are like the canaries in the coal mine for our circulatory and nervous systems, and they often show the first signs of trouble when a central organ like the liver is struggling. Okay, so we've covered swelling, discoloration, spider veins, and strange sensations. It might sound a little scary, but here's the really good news. Your body is giving you these early warnings for a reason. Paying attention to these signals can make a world of difference. It gives you the chance to act before a small problem becomes a big one. And the best part is that you have a lot of power to support your liver's health through simple lifestyle changes. So, what can you do? Let's start with your diet. Adopting a liver-friendly diet is one of the most effective things you can do. This means cutting back on processed foods, sugary drinks, and unhealthy fats, which all put a heavy strain on your liver. Instead, focus on loading up your plate with antioxidant-rich fruits and vegetables. Think berries, leafy greens, broccoli, and beets. These foods help protect your liver cells from damage. Lean proteins and healthy fats, like those found in avocados and nuts, are also fantastic. And of course, one of the biggest favors you can do for your liver is to reduce or eliminate alcohol, which is a direct toxin to liver cells. Don't forget about the power of movement. Regular exercise is incredible for liver health. It helps improve blood flow throughout your body, which can reduce that fluid buildup in your lower extremities that causes swelling. It also helps you maintain a healthy weight, which is crucial because excess fat can accumulate in the liver and lead to a condition called non-alcoholic fatty liver disease. You don't have to run a marathon, even a brisk 30-minute walk most days of the week can have a profound impact. Of course, in some situations, lifestyle changes alone aren't enough, and medical intervention is necessary. That's why recognizing these foot signals is so critical. It prompts you to have a conversation with your doctor. They can run simple blood tests to check your liver enzymes and overall function. An early diagnosis can lead to timely and effective treatment, potentially preventing severe, irreversible liver damage down the line. It's all about catching it early. So, the next time you kick off your shoes at the end of the day, take a moment. Look at your feet. How do they look? How do they feel? Don't ignore persistent swelling, new discoloration, or strange sensations. Your feet aren't just there to carry you from one place to another. They might be sending an urgent message about one of the most important organs in your body. By learning to listen to your body and acting on these early warnings, you can take proactive steps to boost your liver function, enhance your overall health, and prevent serious complications. Remember, the smallest signs can often carry the biggest messages. Your feet are talking. Are you listening? Taking a moment to check in with them could be one of the best things you do for your long-term health. Thank you so much for watching today. I hope you found this information helpful. If you did, please give this video a thumbs up. And forget to subscribe and hit that notification bell so you miss any of our future health tips. Stay healthy, and we'll see you in the next video.